So we had started a habit building challenge on June 1st for doing at least 6 Surya Namaskaras for a day. Most of us did start. We did come to the plateau. Then we started again. So this is also the culmination of the challenge we had now for today. Today was the 21st day. Now we have Dr. Nilima Bedekar, HOD, Musculoskeletal Physiotherapy Department. Shimpi sir, Dr. Apurva Shimpi, our principal and professor at Community Physiotherapy Department. And we have Sucheta ma'am, who she is very well known. I'll let you know the details soon. Sucheta Kadethankar ma'am, she is a yoga teacher. She's student and teacher of yoga philosophy. She's a yoga therapist and she's also a TEDx speaker. She's the co-founder of School of Yoga, offering formal yoga education for yoga teacher training courses. She is a passionate yoga teacher. She has deep interest in ancient Indic wisdom and loves to integrate yoga philosophy while practicing yoga postures on the mat. She is one of the first Indian, she is the first Indian to walk across 1,000 miles of Mongolian Gobi deserts, and she has also entered Limca Book of Records for the same. She was also noted as one of the 32 young achievers of India by India Today in 2012. Ma'am has run several marathons, ultra marathons, participated and won many adventurous races also. Ma'am was actually working in IT. She left her job of 13 years to pursue a career in fitness, physical fitness. So she chose yoga as one of the mode of physical fitness. Thank you, ma'am. Welcome. Next, we have Bedekar ma'am, our very own Bedekar ma'am, Dr. Nilima Bedekar, who has a very keen interest and a special love for yoga. And as ma'am suggests, it is always yoga. She has been practicing yoga since her childhood. Her father was her teacher, so that developed her interest there. Her father was a certified yoga instructor from Kaivalya Dham, from Lonavala. So ma'am actually started developing an interest to integrate yoga with physiotherapy when she was pursuing her master's degree in United Kingdom. Welcome, ma'am. I would now request Dr. Apurva Shimpi sir to felicitate Sucheta ma'am.
Thank you so much and welcome ma'am for being over here. Bedekar, you are also one of the speakers, but nevertheless you are part of the team. So kindly, both of us. This is a small book that is. It is kind of his biography and it's kind of very inspirational. It's something that motivates all of us. So I'm very sure this will have a good impact or good motivation for you.
Sure. Thank you. Thank you. And also, ma'am, just to tell you that we have planted a name and tree on your name. Sorry for that. And we'll be receiving an email notification about that soon. Okay. So that was again one thing that we thought we kind of instead of just. So there's going to be a tree planted on your name. Oh, okay. Yeah, then you'll receive an email about the details. Sure. Okay.
So generally we have stopped giving bouquets or anything because that's not was survived.
Usually it's in an area where the NGO which is doing the job. Last time they had kind of for the last 3 years they had done it around in the place Rajasthan.
Rajasthan or West Bengal or any of the.
And I'll send you a photograph. Okay.
So ma'am, this initiative is called E-Tree for E-Tree initiative, which is called Tiger for Trees. So it is planted in the Sundarbans. For the one which is on your name, it's planted in Sundarbans.
Good afternoon, everyone. So it's a great day to celebrate, I feel. So I'll be covering just a few domains which we use in physiotherapy for stability, endurance, and mobility. So Sucheta ma'am will be talking about the other philosophical aspects without which we cannot complete whole yoga. So today we are talking about yoga for all. And all means all ages, all sex groups, all medical conditions, and everyone. So when we want movement, we would require yoga. So what we as a physiotherapist do is actually integrate this into our program because we apply it for health. And we know that it's now the yoga research is a global phenomenon. Though we have now 22 journals, Indian journals, and many more international journals, I was trying to get the list. It could be because we want the evidence. It was there, this philosophy since ages with us, but it wasn't documented. So we didn't have those proof. And it was not backed up with which conditions. So it was difficult to apply in various conditions, and that knowledge was restricted. So now we are using this for applying in your health. And we know that mind, body, soul, everything needs to be working together. And ultimately, it's the movement. So it comes from the thought process to the neurological system to the nerve to the muscle. But ultimately, it's the muscle, so it's the movement. And we being the movement specialists, so I feel none other than physiotherapists would be able to use this application for health because we know the anatomy, physiology, the biomechanics, pathomechanics, and when to apply on the condition. So I would rather suggest that we would apply this and those who are interested use as a part of therapy because we need to have a successful rehabilitation of the person back into life. Okay? So would go ahead with this. We know that there are benefits, including physical, mental, not only musculoskeletal, neuromusculoskeletal system, but other systems as well. So once we know there are benefits, there are risks. With the risk, it's conditions we are going to apply for. And for using this as a therapy or otherwise for health, there are many challenges. And that's where it just stops. So these challenges are receiving good training because that's very important to develop this practice and to have the skills. So the person needs all this, but with it needs the commitment or engagement because we all know we start, we do it at a level and then it stops and it goes away. And it's not a quick solution. It requires time and patience. So that we must understand that we should keep patience and we have to follow and educate people on this domain. So there are various steps to attain this accomplishment that we need to evaluate in detail about the movement dysfunction, about the medical condition, and hence we can have it as a group therapy also. But in that group therapy, we would individualize and make it a tailor-made program. So certain number of repetitions or certain asanas, certain people won't be able to do. But still we can take it as a group because that also has a good area to be thought of. And additional, we must know that gradual progression into asana is really important and the complexity will be slowly added in terms of repetition and hold time and adding the movements. The richness of yoga postures is phenomenal. I've just brought down few asana poses here. There are n numbers because we can apply to anybody who is even lying in bed, not even allowed weight bearing, to a sports person who needs the highest skills and agility. So all of this yoga has its applications for. I'm not an expert to talk about the philosophy, meditation, and all those aspects that Madam is going to cover. So I'm going to talk about more of a musculoskeletal domain into it, but it has all these multiple dimensions. So always we must consider all this when we want to use yoga as efficiently we can. So when we talk about stability, all of us feel, yes, yoga, it's flexibility and the person becomes so flexible after doing yoga. Flexibility comes little later, we must understand. It's the stability and we need the system which is stable first. Now, when we have this stability, it will give us a static and dynamic. So when it's stable, it's balanced. And we know that that could be leading to a static balance and a dynamic balance. We can have a simple pose as lying in Shavasana, which is the most stable position. But when we want to move, it is going to become dynamic. So then getting into the Sukhasana, it's again a very stable and a static position. So coming into Sukhasana, it's mostly used for many aspects. So Sukhasana, we become more grounded. We start, so its gravity is not acting that much, but we are not completely stable as well as like in lying down. So this Sukhasana is used as a position, and then we can do the further aspects of meditation, concentration, and getting into other poses. Next would come into Tadasana, which is a stable position in standing. But with it, we are going to get the proprioceptive benefits. The gravity is going to ask the challenge. So that's again a stable position, again in standing, which is that. From here, the dynamic positions in sitting and standing would start. Always we feel that, oh, what should be the sequence of doing the asana poses? So if a person doesn't have any problem of weight bearing, we should start with the standing positions in asanas, and then the gravity is going to take us. And all this is going to add to it. Then we can go into sitting positions, which can also be very complex, and then coming to lying down and end into the lying down poses. And then go into relaxation. So always start with a stable position in standing, add to the standing poses, come to sitting, complete the poses, lying down, and end with relaxation. That would end to whole session. So it's like warm up, then doing the exercise, sitting down, completing, and relax. So this stability is very important. In physiotherapy, we understand that we have these core muscles, which bring in the stability into sitting and standing. So there is a huge literature that yogasanas and pranayama, the second part, leads to improvement into this core muscle activation, including pelvic floor muscles. So there we have the core muscle activation of pelvic floor and transverses. We have had a study on this, which has shown the benefit that both this improve, plus the diaphragm. So the pranayama techniques is going to activate the diaphragm very well. So all this core stability is enhanced by doing all these exercises. So once we have regained the static and dynamic stability, we move on further. So on stability domain, there are then further progression into multiple components. So we can, I can't see this Garudasana pose anyway, but once we are stable on this, we can add this stability component. We need this. So from Tadasana, now we can have the Vrikshasana and we can have a Garudasana. So Garudasana is again standing on one leg, to be having an encircle with another, and the upper extremity again. So we have this as an unstable position, and the whole beauty is we have to stand firmly into this position complex. We can see this as the Chandrasana. There are different names given. So these names have come from objects, from birds, from animals, from the position, so many and things. You can see here the Paripurna Navasana. So this now is going to be there and the person is sustaining this. See the stability coming into it hardly. So we have a stable position like standing in Tadasana, going into Paripurna Navasana. So we have n number of articles which suggest that the stability component, the core muscle strength, all this can improve by doing such poses. Of course, we choose. So whenever there is a research domain, we choose a particular segment of people and we apply. When we say muscle endurance, it can be two ways. One is the repetition, another is sustenance. So two ways we work for muscle endurance. And here, this is the ability to sustain and repeat the contraction. What we use here in endurance is the body weight itself. So this body weight and components of body itself acts as a resistance. External resistance is not applied in yoga. What can be done is getting the props. So if a person is not able to sit in Sukhasana, we can add the towel rolls at the end till there is a problem. Once that gets an ends over, we could remove those props. So we know that we can work with this endurance. There is an endurance and various asanas which can increase this endurance of upper extremity, lower extremity, and spine. So we can have this endurance very, very well. We also have pranayam techniques. So never forget about these pranayam techniques, which are going to again exclusively have a endurance in the diaphragm. So many times we just say we breathe and we do things. Indirectly, the diaphragm is going to work. But with pranayam techniques, there are definitive programs which have enhanced the diaphragm muscle endurance and strength both. There are other, just I would like to give an example of Kapalbhati pranayam, where the pelvic floor muscles and transversus abdominis work. Here, the diaphragm is not working. So inspiration is passive and expiration is active. So the pressures in the thoracic cage into the lungs is going to be very different. But with this, it works into the core muscle endurance as well. So this pranayam technique of Kapalbhati is very, very good. Of course, we have to see that how do we start? It's very important. Second is the Ujjayi pranayam. So that's going to control the diaphragm. And that's going to even control the larynx box. So we can have various benefits even to our larynx and our voice and sound. So there are even exercises for improving the endurance like Trataka. So if we are focused, looking at, so the small muscles of eyeballs and eyelids are going to work. So there is a program and activation for all the muscles of the body to improve the strength and endurance and so on and so forth. So we can see certain poses of how the endurance of upper extremity can improve. There are few more asanas even for the upper extremity. So you can see the Bakasana, the crow pose. Yeah? The body is all supported on only the wrist. So you can see what is happening to the upper extremity out here to the Mayurasana. So here it's in flexion and here it's in extension. So this Mayurasana, whole body is supported onto the elbows. Whole of the weight is taken and the body is completely anyway, you can't see that Mayurasana out here. So you can, this two examples. There are Lolasana that you have Baddha Padmasana and you put your hands down and you lift your whole body up. So it's going to actually work very well. You can see how the shoulder muscles and the shoulder girdle connected to the pelvic girdle is lifting up the body. Sole of the latissimus dorsi are going to work with it, as well as whole of the wrist, the elbow extensors, the shoulder girdle is going to get connected and the body is lifted up. So holding time, repetitions of these complex positions is going to add to the upper extremity endurance. So there are many more poses of even upper extremity endurance. So we can consider any of this. You can see Ekahasta Padangushthasana. So standing on one leg, taking it up and holding the great toe with the hand. So have a look at this asana and being stable and for a few seconds. So it's not only standing on one leg, but going into the dynamics of it, and it can add to various muscle work. So there is a lot of scope. Though we have a lot of evidence and research, there is still a lot of scope on how it works with the kinetic, kinematic analysis and so on and so forth. The best of all for endurance is the Virasana. And if anyone wants to take a challenge, can do it today after this talk. So in Virasana, the person has to sit on the forefoot. Other leg is crossed over on the thigh. and the person is folding the hand. So this is the start position. So you must be able to hold this in sitting first, and then you have to get up and go down again. Okay. So Utkatasana we know, coming to chair and come up. Okay, so it's eccentric, concentric, and holding, coming up. So concentric, eccentric, isometric, all that work is there. But now it's the whole body weight supported only on the forefoot, coming up and going down, and repeat. So what I mean to say that endurance can be worked up even without the weights. Of course, it's difficult to go it into slow steps, but if we give it gradual progression, we can add. So we need to have all these things with it. So there are many poses which can do endurance and strength. There are n number of articles. I've just brought down a few. How the muscle endurance and yoga practice, even the reaction time, the respiratory endurance, the walking endurance, and there are many conditions, even like neurological conditions, where they have used to improve the muscle endurance. So not even the musculoskeletal, but the neurological problems also have been sorted out. So there are many asanas which are going to lead to a very healthy muscles, and the joints have to support. So first with the stability, then the muscle work. So we need to have the muscle work for stability, then it will come into the practice of repetition, and just a few examples of this we would understand. And then will come the mobility and flexibility. Mobility of the joint structures and flexibility of the muscle structures. And we know that this ability to move freely and easily, to have this mobility and flexibility in yogasana practice, we can hold that position of the limb passively. So that is also there. So the person is self-assisting the movements and then sustaining that to be able to do. And we know how long the stretch should be put for. But the most beautiful part of these asanas is involving multiple segments, not only one joint. It's okay if the elbow is involved, but what is happening to the shoulder? Because the muscle flexibility of this depends on the joint above and below. So the beautiness of yoga position is it connects not only single segment, but the limb to the other limb and to the spine. So it connects the whole body into various positions. And hence there is a neural tissue which gets stretched. If the myofascia gets stretched, the muscle tissue gets stretched and the skin overall. So from head to toe, the fascia is connected. And these muscles are not into one line. They are into various directions. And hence we need to have the stretching into all those directions overall to have the better stretch. So I feel any flexibility component should be thinking about using these positions. And the flexibility books have only given only the acknowledgements, and hence we need to bring in more research into it. So we have this multiple segments, and you'll appreciate how this mobility and flexibility we can have overall. So when we have the Dhanurasana, all of the anterior structures are being stretched. As a physiotherapist, what I suggest is Dhanurasana cycle, Pavan Muktasana cycle. This is the end position we are seeing. So we have a destination, we give it particular, and we start doing this Dhanurasana slowly. So we go into various asanas first before coming to Dhanurasana. When we want this as an end position, we start first with doing the spine extension or with assistance. So we can go into one asana first. Then we go into alternate hip knee flexion. Then we can go into Shalabhasana, Ardha Shalabhasana, alternate hip extension. And then we go with both knees into flexion and then hip extension. Then come down and get into Dhanurasana pose. So this end position, we can go and break down and start with Bhujangasana, start with Ardha Shalabhasana, start with alternate hip knee extension, then go with both knees hip extension, and then go into Dhanurasana pose. With this, again, there is a stretch over the anterior structures, over the hip flexors and the quadriceps. So there are multiple components which are going to get stretched. And against Pavan Muktasan, again, I see a cycle. So we start doing alternate hip knee flexion, then bilateral hip knee flexion, then assist both knee flexion. If a person has a knee pain, hold it again under the thighs and get into the position. Then we come up into flexion position and then we go into Pavan Muktasan. So whole of this fascia is going to get stretched when the person goes and moves side to side and front to back. So there is a very good myofascial release happening over this in Pavan Muktasan, happening in the Nurasana. So think about giving such positions. Always think what people want. You may not say I'm introducing you to yoga, but we may ask that would you like? Some of them are very keen. So what our knowledge and expertise we can offer. Always remember this. The most beautiful part of yoga asanas is correcting the asymmetry. I want to always see that. We all have some asymmetry in our body and we want symmetry. A face looks beautiful if symmetry is there. So we understand what beauty is symmetry, nothing else. So our eyelashes are different, our eyebrows may be different, our nose may be turned to one side or anything. So it's the symmetry which looks beautiful. And to get it, we should know what asymmetry is. So this position of Ardha Matsyendrasana, so we know how much one can reach to, or we know even in Trikonasana, how much we can go down on one side, can we go easily on the other side? So if we know going to one side, rotation is so much, whether other side is that or no. Now this is having multiple segments of hip and knee. So it's opening the hip and knee so much, and the spine is rotated completely out there. Then we have to go on the other side. Can we do the same on the other side? Is the person allowed to do this? That you will have to apply when you're going to get them into this position. Gomukhasana. I feel everyone knows this. So we can say whether we can touch both sides equally or no. You can try that yourself. Does it happen to you on both sides equally? How much you reach, whether hand to hand reaches and it's used as a flexibility or no. And you will be surprised that both hands you can't reach equally. So you can try to get the symmetry and this subtle of few millimeters, we can document that the person wants to progress, means what? So what is happening overall into whole flexibility? Of course, we break down and we come into composite. So from composite, there can be a problem in one area where other side is overstretched. So as a physiotherapist, we must look into this domain also, that where is the moment error happening and is it compensated somewhere? So then we have to break down and bring it back into it. So understanding about this asymmetry and where it is lacking is also very important. And I feel the richness of yoga practice is really marvelous. So coming to this Ardha Paschimottanasana. Paschimottanasana we know. Okay. Sitting, long sitting, trying to touch. How much can you touch the great toes or can you encircle? Can you touch your head to the knees? So getting into all of this complex position, which is going to completely stretch the posterior aspects into a stable position. We are not going to down to touch on the finger to floor. Okay? Here the person is sitting. So we can observe the difference, how the person is doing in standing and sitting. And here is a symmetrical pose. So the other hip is flexed, abducted and external rotated. And the person is now going to touch and see how much he can reach. Here, there is a flexion and rotation to the side. So it involves all of these aspects on one side. The hamstrings, the adductors are going to get stretched. And try on the other side. And see a breakdown and see where the components are lacking into. So that's going to really stretch this posterior aspect so much. But at the same time, it is the hips which are going to open up, because that's very important. We have n number of studies into improving this flexibility, and they have and adolescent school boys. So we also have flexibility pilot study on effects of selected asanas, and it was done on elderly women. We have all this into very good high standard journals. There are also articles which suggest once a week session also help for 8 weeks. As simple as 1 week session also help, but all the components did not improve. So we need more days into it, but single session for longer time can also work over a period of time. So we can see so much and so on. We cannot actually say that this asana is only for flexibility or mobility or something, because it comprises of so many movements altogether. So whenever any journal article we will read, maybe there is a focus on muscle strength, endurance, flexibility, but many a times we add to multiple components and we see which is more effective. Also, we never forget that what is happening to person's function and what is happening ultimately to quality of life. So many of the studies now when we read, it's not only evaluating only the flexibility component or the muscle strength endurance component, but how this flexibility and endurance has worked into a better function for a person, that is also looked into, and how the person is leading his life, because that's all we are for, that how happy we are in life, what is the quality life we are going to get. And especially this is very more important, it has come to us, especially this post-modern, post-technology era. Now, we can't say even post-COVID, but in COVID era, we are yet. I hope this COVID era, we also talk it as post-COVID era. And soon this goes away as something. But this has opened up a new things to us, that we are getting connected in a different way. So when we are using this technology and we are connecting in a different way, we need to know we are connecting in a position where we are sitting and more static. So that dynamic shouldn't be lost, the movement should not be restricted. So we are looking more towards, and we are looking at, okay, getting low back pain while sitting or neck pain because of using mobile, doing all such things. The stress of attending all these sessions, so mental physical stress, which has brought in this, the life has become really different. And hence we need more research. So although evidence is there, we need to continuously have this evidence, because the change in the way we are living in. But I feel we have got this opportunity in this COVID era of using going online, getting help from n number of people out there. But we are getting back into getting connected with people, because howsoever we observe online, we need to actually touch, feel, see where the problem is, and we have to address. So I would say, as a physiotherapist, we complement it with our therapy. We cannot completely replace it unless if the person is completely getting into his her at least 80 to 90% of the muscle function and the joint function. Then we can say continue doing yoga as a practice, because nobody would like to have a level of a patient. So when we say a person that likes to do yoga, because the person would feel, oh, I'm more normal now. Having physiotherapy session, doing some exercises, may not feel that it's normal. So I would say once the person recovers, we can give this part that, okay, you're going to have yoga as a practice. And they can have a group session. So it's getting back into a normal, healthy life. Then we would say, okay, do only certain exercises for certain time and complement this part of it. Okay. So it will be really good if we bring into them to that step and they take them further. So we all know that, okay, one joint is restricted, there will be pain in some other way. So if the mid-thoracic level, there is a problem, we really have to look into what is happening to the neck, to the shoulders, lower spine. So when mobility is restricted, then comes to the thing. So we really analyze this. When a person is doing this trikonasana, we can analyze. When the person is going into bending down, we see where in the spine is the problem. So we know where the problem would be by doing a movement analysis and correct it. So lumbopelvic rhythm, we know if it is altered, can we bring it back? So we can check all this, and loss of mobility would lead to that problem. But we may not be able to gain mobility first. We will have stability, the muscle control, then we get into flexibility again. So we go into this circle to have the complete function, to have this various poses. I would love to bring in these poses to you, and you can practice any of these if you have no problem. Go into steps. These are some of the advanced poses which can be there. So Ardha Chandrasan, and you can do on either side. Ekapada Dhanurasan. So if you can go into Dhanurasan and get into there is a Chakrasan. So there are many poses which you can go into. The Natarajasan pose. Dancers would be there standing into this pose. Even it can get more complex that the feet is touching to the head. So it can be going more into complex into it. Now we have Adhumukha Svanasana and we have Halasan. I haven't brought into it the inverted poses, the Sarvangasana and Shava and the inverted complete pose. Because even an 80-year-old does Shirsasana, have no problems. But as a physiotherapist, we don't bring into those poses to people because it can load the cervical spine. So unless we are sure about all this and we take them into steps, we get into props. So what we do is put people on tilt table and get slowly into that position. We see what is happening to the vitals and we can modify. So we use props in order to get the benefits to some degree. But there are inverted positions. It has got in all benefits, such as the Shirsasana and Sarvangasana. The Halasana, you can see the plow face. It is completely going into it, but see what is happening to the cervical spine. So, if no problem, continue doing it, because if we don't use, we will lose. So we know that. So think about various positions. Think about what your skills are. Train yourself. Get into a good stability, mobility, endurance, and work towards it. The last here it's Veerbhadrasana. There are 3 different aspects. Here is again the 3 warrior poses. So all this can lead to better function. So overall, the awareness, we need the awareness to come into position, and then our awareness also improves. So it's awareness cycling. So we sequence it. We go from static to dynamic to static, more difficult poses. And the most important, we enjoy this, because Thiram Sukham Asana. Any asana should not cause pain or distress. It is only the stretch, and the stretch can be really cooling down. So this stretch should be felt at every step, and it needs to further. So it's the enjoyment when we are going to do. With this, I end talking about the stability, awareness, and endurance and mobility. Okay, we'll have some questions if you have. After Madam will take you to the next level, really. So thank you again for the patient listening.
Thank you, ma'am. So with this, we also understand that endurance, stability, and mobility is not just important for your muscles, but for your mind and your nerves. Yes? You can trust that. Thank you, ma'am. So as a physiotherapist, our major goal is pain relief. Yes? Everyone? As a physiotherapist, the first goal is pain relief. Then we think about range of motion and functional activities, right? So now Sucheta ma'am is going to talk about Yog Nidra and its therapeutic effects on pain.
So, hi everyone. First of all, thank you very much for calling me here and giving me the opportunity to share what I extremely am passionate about. And I I always like to share this with people who probably would take it ahead and contribute and have a certain kind of impact on the health well-being of other people. So I'm extremely glad to share this with you all. This is a very targeted and focused group. So I'm especially glad about it. So thank you very much for coming. So my topic today is Yoga Nidra and its therapeutic benefits on pain relief. Okay? So I just learned that you all had your lunch. So, but I'll make sure that you all don't go into Yoga Nidra. I'll first start with, I'll break it down. Yoga, Nidra, and pain. So we are basically talking about these three things: yoga, Nidra, and pain. And so I'll first start with yoga. So Madam just explained to you various postures. Of course, asana is one of the aspects of yoga that Patanjali Muni has described to us in this Ashtanga or 8 limbs, right? Which is the Yama, Niyama, and Asana. Asana is the 3rd limb of the Ashtanga yoga system that Patanjali described to us. But when he described yoga and when he gave us the definition of yoga, so not just Patanjali Muni, but almost all of the ancient literatures, ancient Indic texts, whenever and wherever they talk about yoga, be it Bhagavad Gita, be it Yoga Vasishtha or Hatha Yoga Pradipika, Patanjali's Yoga Darshan, any of these texts, they are not at all talking about physical postures. When they describe yoga, they are talking about mind, always. So any definition, they are talking about yoga, chitta vritti nirodha, means yoga is about stopping the fluctuations of the mind. That is how Patanjali Muni describes yoga. Then another text here, Bhagavad Gita describes yoga as yoga karmasu kaushala, means skill in any action that you do is yoga. Then Yoga Vasishtha says mana prashamanopaya, means calming down of mind. Upaya, tool to calm down the mind is yoga. So if this is so, then where do the asanas come into picture? The physical practice comes into picture, and how do we connect it to what is being told to us by all of these ancient texts as yoga? Right? There has to, and we all the time hear this term mind-body connection, mind-body connection, mind-body connection, right? And that is where this whole concept of yoga nidra enters, and the benefits of yoga nidra, which is a very beautiful tool that yoga has given us. It comes into picture, and then we can basically understand it. Okay, so by now we've understood that yoga, whenever they describe yoga, they are talking about mind. They are not really talking about yoga is asanas or yoga is setu bandhasan, yoga is padmasan. They're not talking about that. But they are surely saying that you practice all these postures. Why? Ultimately to attain that calm state of mind. Right? And when you are not in discomfort, you are in a calm state of mind. So when you are not in, are we thinking of? Which sheath are we really dealing with? So when we are thinking of pain management, yoga says that you also need to think of the pranamaya kosha and manomaya kosha, not only your annamaya kosha. Okay. Now, does it happen that there are 2 people having similar symptoms of pain? Everything is similar. You give the same kind of exercises, physiotherapy, everything same. One recovers faster, the other doesn't. It happens. If it was one-to-one relation, that this works globally for everyone having these symptoms, right? Then everyone would have recovered within the same duration, same span, same speed, isn't it? It doesn't happen. And why? Is because there is pranamaya kosha at work and manomaya kosha at work. So if we are talking of pain, probably say, if we are saying approximately 20 to 25% of the pain is about your physical body, which is actually the pain, which is caused by the trauma or accident or misuse, underuse, overuse, any of this. That is what we will be treating with certain treatments and medicines and movements, which are at the level of Annamaya kosha. Okay. Then say if you are imagining three concentric circles, the innermost circle about 20 to 25% is this pain that I'm talking about. Then outer circle is basically the fear of that pain. Know that I am in this pain and it's taking so long to recover, and what will happen? Last time I had a similar issue, it had taken 6 weeks. Now again it has happened. I took so much of care, still this has happened. All of this is basically coating that pain and making it a bigger circle, right? And then the outermost is basically probably anything that, because of this there are certain limitations. I'm not able to do this, I'm not able to do that. All of these restrictions are again putting another layer on top of it. So this is what yoga would help you deal with. The deeper aspects of yoga. When I'm saying deeper aspects of yoga, what madam already told you is the Bahiranga yoga. Bahiranga yoga and Antaranga yoga. Antaranga is internal aspect of yoga. Bahiranga is your yama niyama, that is how are you behaving in society, how are you treating yourself, then your asana, are you treating your body well, then even the pranayam would come in Bahiranga yoga. How are you managing your energy, and how will you manage your energy is through your breath, because that's the only tool we have to reach the energy, otherwise we can't reach that. Then there is a bridge in between which is called pratyahara, we won't get into it. And then comes the Antaranga yoga. And this practice of Antaranga yoga helps us tap these two outer circles, which are around the actual pain, physical pain, which is in Annamaya kosha. So when we are tapping these outer circles, two outer circles, we are basically getting to the cause of the pain. Right? Now, when we look at anybody's posture, there is certain energy that we feel, isn't it? So do we ever see a person who is very, very confident and having drooping shoulders like this and standing like this? We don't. That's posture, that energy enters into the posture and it also reflects, isn't it? Now we don't see a very, very shy kind of a person who is afraid of talking or interacting or expressing this way. Similarly, a person who is, so basically these two things always go. So I will just jump into Yoga Nidra now. When we are talking about Manomaya Kosha, Annamaya Kosha interconnected, this is how we can feel, we can see, we feel that energy which is hidden in the Pranamaya Kosha. Now what happens is, in Yoga Nidra, which is known as conscious sleep. Okay, so what happens in sleep? Say for example, if I ask you, a person is in extreme pain, he has chronic pain, all the time he is into pain. When that person goes into deep sleep, what happens to the pain? Is the pain gone? No, the pain is still there, because when he wakes up, he's going to feel that pain. So where has that pain disappeared suddenly in the sleep? What is happening in deep sleep? There are stages of sleep, right? So there are certain waves that our brain produces. So and there is beautiful mapping in Mandukya Upanishad. They have described 3 states of our consciousness. First stage is Jagruta Avastha, which is the state of wakefulness, which I hope we all are now. You all are awake now, right? So that is Jagruta Avastha. Then, and what is happening in Jagruta all our five senses, Pancha Jnanendriya, all our motor organs are Pancha Karmendriyas, and our mind are functions. So there is external transaction that's happening. We are externally oriented. We are taking in inputs. Our mind is responding to it, and then our actions are happening accordingly. That is our Jagruta. So when we are talking about brain, when the brain is in Jagruta, our brain is operating at a certain frequency. There are certain waves that are generated. Then so this is Mandukya Upanishad talking about Jagruta Avastha. Even neuroscience talking about Jagruta Avastha describes your brain operating at certain frequency. Then there is Swapna Avastha, dream state. In Swapna Avastha, what happens is your sensory organs go into sleep, but your senses don't. There's a difference. My ear can hear, but this is an organ that you see at Annamaya Kosh level. When I go to sleep, my ear as an organ is sleeping. But in my dreams, can I hear? I can. I can hear all the sounds. My ability, the potential to hear is still present. The potential to see the dreams is still present, even if I have closed my eyes, isn't it? That's how we say that I see dreams. How can you otherwise see with your closed eyes? Because this is an organ that is sleeping, but the potential to see, the potential to smell, the potential to taste is still there. Right? Now, this is a different level of reality. You can't say that's not real, because that is real at that level. That is the reality of the dream. Now, if in dream I am hungry, okay, and someone wakes me up and says, "Oh, you wake up! You are seeing a dream and it looks like you are hungry. Eat this pizza." I'll say, "No, please let me sleep." But if I get a pizza in my dream, I'll be happy in my dream, isn't it? So that is the reality of the dream. That is Swapna Avastha, when your mind and the potential of the senses is very much active. That's Swapna Avastha. In Swapna Avastha, according to modern science, again, your brain is operating at alpha and theta waves. Two different things, obviously. There are two stages, again, where the deeper emotions release at this stage of theta waves. And there is an ability of conscious dreaming also. Your brain has the ability to consciously dream. If you have ever experienced it, you don't want that dream to end. You know that I'm dreaming and you don't want that dream to end because you want to see what happens. What happened? So you keep on dreaming, and you don't want to get up because someone wakes you up, you say, "Arey, sapna dekhte." Yeah. So that is that ability of conscious dream. Okay, and then obviously the deep sleep, Sushupti Avastha, which Mandukya Upanishad also describes, where it's just you are completely unaware of what's happening outside. So does that mean that the outer world has disappeared? No, it very much exists, just like the pain exists in deep sleep, but you are not aware of it. Okay, and then Mandukya Upanishad tells us the fourth state, which modern science does not talk about, and that state is known as Turiya, Turiya, Turiya state. This Turiya state, what happens in this state? In this state, you are an observer. So it's you only. When I am awake, when I am in Jagruta Avastha, my sense organs, motor organs, mind, active, completely active. Turiya, non-changing, still there. Just observing what I do in Jagruta Avastha. When I go to dream, my sense organs, motor organs sleep, but my potential of senses is alive. My mind is at work. Turiya does not change, just observes. What is she dreaming? When I go to sleep, everything is sleeping. Turiya is not sleeping. It is not even awake. It is not even dreaming. This Turiya is the state which never changes, which just stays there as an observer. if you were sleeping and if you get up in the morning, how do you know that, how do you say that I had a very good sleep today? You were sleeping, how do you know you had a good sleep? There is a part of us which observes always, and that is this state of Surya. Now, Yoga Nidra, what does it do? Yoga Nidra is conscious sleeping. Yoga Nidra gets you into the state which is a borderline state of wakefulness and deep sleep. So your brain operates at the level of your alpha and theta waves, which are basically conducive for conscious dreaming and deep emotional release. Okay. Now, a lot of chronic pain, like I gave you an example of two people, you give the same treatment. Why is it that the other person is not healing? That's because there's something inside which is holding him or her back. And Yoga Nidra would tap that, and that release will probably happen. It could be a trauma of that incident when that person had a fall or slip or accident or anything. It could be that. Or it could be that a person has always been in a state of anxiety or stress or fear all through the life, because of which certain body parts just went into contraction. Always like this. Okay, always like this, fearful, okay, worried. Always like this. So certain body parts were just contracted and some other body parts compensated, and because of that certain condition has arisen, and because of that that person has pain. Now the deeper cause of that fear or anxiety could be tapped with the practice of Yoga Nidra. So what happens in Yoga Nidra is, Yoga Nidra is always practiced guided. One can't practice Yoga Nidra on his or her own. Then you have to be a yogi to be able to practice Yoga Nidra. Then you don't need Yoga Nidra for pain management. But otherwise, Yoga Nidra is always a guided practice. So what happens is, you get that person lie down in Shavasana, and then slowly, step by step, you take him to a condition where the body is completely relaxed, but he's not sleeping. So we keep that person on borderline, because you keep talking. It is like a psychotherapy. You keep talking to that person. That's because when you are sleeping, your hearing sense is the last one that goes off to sleep. Right? So that is the last one to shut down. So you make use of that condition. Swami Satyananda Saraswati of Bihar School of Yoga has basically given a new structure to this whole practice of Yoga Nidra. So what do you do in Yoga Nidra is, you basically first have that person lie down in Shavasana. Then you practice body awareness, body relaxation. So you have that person relax the body parts. You give suggestions accordingly to feel the body parts. Then you rotate your awareness or your consciousness throughout the body. So they generally start with the right hand thumb. So you become aware of the right hand thumb, then the second finger, third finger, fourth finger, fifth finger. So once you become aware of all of this, then the palms, then the arm, shoulder, waist, hips, thighs, legs, like that. So you rotate your whole awareness, consciousness throughout the body parts. So one is not expected to move that body part. One is just expected to become aware of that body part. Once this has happened, you move to breath awareness. Once you become aware of the breath, then that person is in a state where he can consciously dream or visualize. So you give him or her visualization. How does that visualization work? So it is, Yoga Nidra is, most of the times it is tailor-made. So if you know the history of that person, what has caused him pain, in visualization, you would replace that. It is like overwriting that old file with the new one. You replace it. You give a different kind of visualization for that person to replace it. So probably you could have that person relive those moments and have that whole experience of being pain free. Have that person feel how it feels to be pain free, and then you end. There are other parts also like a sankalpa or a resolve for yoga nidra, which is optional. So that is how yoga nidra works. Of course, yoga nidra is not going to make that person pain free in just one session. Generally, it is 40 to 45 minutes, but repeated sessions. So, what I would do is I would record that yoga nidra and give it to that person for practice. So that person just plays it and goes off to sleep. In yoga nidra, one is not supposed to go to sleep, but because the body is so relaxed that invariably people sleep in yoga nidra, which is fine. But if towards the end of yoga nidra, within 3 to 4 minutes, the person gets up, that means that he or she was able to do the practice of yoga nidra. Because intuitively, he is also getting up at the end of the nidra, is not going into deep sleep for a long time. But it does happen. But as a guide of yoga nidra, you would keep on telling, don't go to sleep. You are not sleeping, you are practicing yoga nidra. So this is how yoga would help in managing pain by basically through yoga nidra tapping the pranamaya kosh and manomaya kosh, because this is what affects the annamaya. If you have any questions, then you can ask. People to it. Thank you. Thank you all.
Thank you, ma'am. Hopefully, all of you did not go to sleep. I hope. Thank you, ma'am, for making us aware of the different modes of stress relief or pain relief we can have. Also, in physiotherapy, we use something called as mental imagery, which is maybe very similar to the yoga nidra. Thank you, ma'am. Thank you, Sucheta, ma'am. Thank you, Bedekar, ma'am, for talking on endurance, stability, and mobility, and on yoga nidra. So I expect, or I wish, our PG students here would try to incorporate that in your treatment with your patients, and maybe get back to us with the results. If you guys have any questions, you can shortly ask.
Well, I guess yoga is much more important, and I guess we are going to use aspects of yoga in our management of patients at many different levels. So, as ma'am just mentioned about endurance, mobility, strength, we are going to be using yoga for that also. And as Sucheta ma'am also pointed out, we are also going to be using it for pain relief also. So this was a very different aspect that Sucheta ma'am talked about, which we usually do not connect with yoga because we have our training in a very different way, where we look at but we do treat patients with a biopsychosocial model. So we do have that beach covered, which is called psycho. All right, so there's a lot of psych involved in pain. There's a lot of psych involved in weakness. There's a lot of psych involved in breathlessness. So no matter what elective you have taken, I guess there's a role of yoga in each and every aspect of our.
It is there in their syllabus.
Yeah, that was without saying. So the first year syllabus, ma'am, actually we have undergraduate. Even the
PG, they have
when we were talking, yeah, they have advances, so they learn the basics in the first year undergraduate, and they go on to learn more about it in the postgraduate. So I would kind of ask if anyone has any questions, you can ask. Otherwise, we can kind of.
They are trying to practice yoga.
No, they don't have you. But what to say? Open eyes.
Yeah. It was very interesting. The concept was very new to us. And okay, so if anyone does not have questions, I can kind of proceed to the next part, where we kind of thank both ma'ams for enlightening us. So today is the International Yoga Day, and we kind of started with a 21-day habit building Surya Namaskar challenge from the musculoskeletal department, and we had kind of made all the postgraduates participate. All right, so we had told them it's mandatory to participate, and I hope everyone has stuck to their. I can tell you that. So I hope all of you all also have stuck to your kind of the challenge or the conviction or the practice of yoga, and I hope you all can see the difference in 21 days. I have. So I guess if we can even, one few of you all can just write a few words how this whole process has helped the ones who really diligently did it, that is. So I would like you all to put it up with words, and for this culmination of the 21-day habit building, we also had the student council, which kind of organized a beautiful program today called the Yogathon, and it was very impressive about students coming at 6:30 in the morning and challenging each other with how many times they could repeat. And ma'am, how much was the time limit?
No, we had given them a limit of 108 Surya Namaskar.
Oh, okay. And
If
how
they
soon
complete
they
them,
could?
that's it.
And they had a team, right?
Yes.
Okay.
6, 7 or 8.
Oh, 6, 7 or 8 people. Okay.
And then
One?
the winner team has done it in 16 minutes.
Wow. Oh, great. So I think most of them were first years and second years, undergraduates. So they have participated and they kind of did it in a nice way. And this also was our culmination of the 21-day, where we thought we could, as an International Yoga Day celebration, we could enlighten you with some aspects. And ma'am is an expert as far as physiotherapy and yoga, the culmination of these two schools of thought is concerned. And we had Sucheta ma'am telling us about a very different aspect. And ma'am's journey also has been very inspiring. I mean, when I went through your, certain points like about you being in the Limca Book of Records, and just participated in, if you all have some Puneites may know, there was a race called Enduro. Right, it was one of the biggest challenges of endurance, which was organized, I think, by NEFL. Yeah, so it was National Education, sorry, Education. Because this one Venki's also was sponsoring it. So basically, it was a very high endurance event, which was kind of done only, and it was held also in the NDA itself, in the NDA campus. So yeah, the Panchit backwaters. So it's one of the toughest endurance challenges, and ma'am has not only participated but also won. And the Gobi Desert 1,000 miles is like unbelievable. And of course, because of that, she's also been participating in many of the ultra marathons. So I guess all in all, ma'am has been a very apt guest for us today for the International Yoga Day. And I hope her journey inspires all of us also. We thank you, ma'am. Thank you so much. And we thank Nilima ma'am also for telling us about our musculoskeletal aspects of how yoga can be blended into musculoskeletal therapy. So thank you both. Thank you.